Good evening to all. Uh, Myself, Dr. Varun Bafna. I'm a hematologist from India. Thank you for the opportunity to having a small discussion about the recent abstract which we have presented in the EHA 2026. So this was a study of HT6184MDS001 on behalf of Haya Therapeutics, which is a sponsor. It's a first-in-class modulator of NEK7 and its clinical activity in the patients with the low risk MDS. The finding from the studies we'll try to see. Basically, everybody is aware MDS is a disease of problems with the differentiation of the hematopoiesis and other erythropoiesis, everything. But the main concern is not up to here. The findings what we are getting is basically with the innate immune mechanism is also involved here. That is related to NLRP3 inflammosome. And there are some inflammatory markers that takes place that gets activated because of the different enzyme inflammation, and that leads to the activation of caspases 1 and inflammatory cytokines interleukin 1, beta and 18 releases and causes pyroptosis of the hematopoietic and progenitor cells. So this leads to your decrease in the production of all the cell lineages. So OFIRNOFLAST is the first-in-class drug where it usually allosterically inhibits the NEK7 and prevents the assembly of inflammasome assembly complex formation. It also dissolves the already formed NLRP3 inflammasome assembly with ASC specs, and GATA1 activation also it helps. And other thing also, it is a main, basically it is helping the conversion of differentiation with the help of GATA1. So the study was designed basically for the IPSS low score with the score of less than 4.5, which are symptomatic anemia, transfusion-dependent, EHA refractory, intolerant, ineligible, and OFIRNOFLAST was given as 2 mg once daily for 5 days a week and 2 days off for up to 32 weeks. And improvement, the primary endpoint was to look the hematologic improvement outcomes at the end of 28 weeks to 32 weeks. So the statistics, total 37 patients were enrolled and analysis was done according to modified intent to treat of 30 patients. As per study population, so basically the median age group was 66 years, as it is younger because most of the patients were from the Asian population. So the other, as per the WHO classification, MDS with low blast were also included in the study with 5q deletion, SF3B1, IB1 and MDS MPN were selected in the patients. So patient disease history basically characteristics as 60% of the patient were transfusion dependent and 16% were in that 16 patients have the high transfusion burden and 2 with the low transfusion burden. So ESA, there were 53% as ESA refractory and the 23% each were intolerant and ineligible. Again, mutations were seen in most of the patients and IPSS median score was around 3.5. And the hemoglobin was 7.4, and that is an important point of the baseline, and then we will see how it has improved. For the first safety, patients turning first to safety in all the 37 patients, patient drug was very favorable, tolerability with no any major side effect profile. Grade 3 and grade 4 events were seen, occurred in only 11% of the patient, that was treatment emergent, and treatment related were only 5 to 7%. So the basically grade 1 to 2 were around 45% of the patient, and that were common with the related to fatigue, cough, anemia, leukocytosis. And there were no any events related to major consensus with the treatment related adverse events. So hematological improvement we have seen in almost 66.7% of the patients, with around erythroid improvement in 93 of 30 patients, and the other neutrophil and platelets also improvement has been seen in around 2 patients each arm. So across the ESA status, WHO and mutation class, most of them has responded good, and overall the results were around 66% improvement has been seen. In that, around 55% of the patient were transfusion independent and were maintaining for 8 to 16 weeks, were around 39% of the patients. transfusion independent. So the median hemoglobin, median duration of transfusion dependence was around for 28 weeks was ranged from 11.3 to 34.9 weeks. So notably, a modest reduction in transfusion burden was also observed in a small number of non-responsive patients, though it did not meet the minor HIE criteria. With the erythroid, neutrophil and platelet has also been shown a better improvement. So mean change in hemoglobin was seen, it was maintaining above the 1.5 gram from the dotted line what we have mentioned, shown in the statistically significant from the baseline. The hemoglobin over the time in transfusion dependent patient also achieving the transfusion independence was seen in 10 transfusion dependent patient for at least 8 weeks was fantastic. With this, they also reported the quality of life. The quality of life was also has been seen. It was most notable improvement in the social well-being, which was increased by 72%. Fatigue has improved over 44% of the patients. So overall, in all the aspects, as per the quality of life e-scoring system, so there was 66% improvement overall has been observed. So to conclude, overall, the 67% of the eligible patient achieved hematological improvement with 63% of the erythroid improvement and 60% in platelet and neutrophils. So it's a first-in drug, oral drug, which has been helpful in low-risk MDS patients. The median in responder patient, the hemoglobin improvement was robust with a median peak of increase of 4.6 gram has been noticed. And with the high risk, some of the somatic mutation has been SF3B1 and mutant in 5q deletion, it has shown a good results. And together this finding supports that NEK7 mediated modulators of NLRP3 inflammosome, the culprit feature of the MDS, is a promising therapeutic strategy for improving ineffective hematopoiesis in low-risk MDS. Thank you very much, and I thanks Haya Therapeutics for sponsoring the study and allowing me to present our data. Thank you very much.